Hi folks! In this video we'll be talking about an issue that hits home for many Americans as well as others living all around the world, the issue of obesity and sexual health. Everyone has something to say about the obesity epidemic. According to the CDC, 40% of Americans are obese. When talking about obesity, experts and armchair experts alike focus on the major diseases brought on by obesity and the surface issues of beauty and belonging. Of course, there's a lot of discussion and information out there about diabetes, heart disease, and other issues related to obesity. But what about sexual health? Shouldn't that conversation be happening too? We think so. So let's talk about obesity, sexual health, and what people need to know. So, how are obesity and sexual health linked? Many men suffering from obesity may also find themselves dealing with a diagnosed medical sexual dysfunction or a psychological issue with having sex. That's not to say that all obese men have these issues. However, obesity certainly raises that risk. There are two underlying types of sexual dysfunctions: physiological and psychological. Let's talk about physiological reasons first. Men who have diseases like high cholesterol, hypertension, heart disease, stroke, and diabetes can have sexual performance issues. In fact, men who have diabetes are 50% more likely to have erectile dysfunction than other men. Why? Obesity contributes to excess narrowing and hardening of the blood flow, which makes it more difficult to swirl around a larger body down to the penis with the vigor that causes the erection. These diseases all contribute in some way to the prevention of either getting an erection or maintaining it. They damage the inner linings of the blood vessels of the penis, which then causes a restriction in blood flow due to lack of dilation. Obesity can also happen as a result of reduced testosterone in the body. It's the original double-edged sword here. Testosterone starts the whole erection problem off, and without it, or with less of it, drive diminishes. For most men, testosterone starts taking a dip between ages 40 and 50 and continues on a fast decline after. Then there's the inevitable cause, age. With age, sexual stamina decreases. The whole body ages, so it's natural that a man who's used to producing an erection 4 times in one day in his 20s may only have the urge or ability 3 times a week in his 60s. Now let's talk about psychologically rooted sex stoppers. Often overlooked, psychological reasons can cause huge waves in a man's sexual health. Of course, issues like depression and anxiety can physically manifest as ED. However, there are much more nefarious effects of psychological issues than ED. An obese man may be able to produce and maintain an erection without trouble. But that doesn't necessarily mean that he isn't having sexual problems. Poor self-image is one reason. An obese man may shy away from intimacy with a partner. Potential rejection, fear of another person's unkind judgment, or a demoralizing sense of self can also lead an obese man to ignore his sexual health. It can also diminish his ability to perform fully or at all. Thankfully, research has shown that 95% of erectile dysfunction can be easily treated, even for men who are struggling with obesity. First and foremost, a man must address the root cause of his problem, be that medical or mental. After that, he needs to take doctor recommendations and also make lifestyle changes. Things like adopting a healthy diet, bringing more movement into each day, getting adequate sleep, and not smoking are all critical parts of reversing sexual dysfunction. Doctors also say that a weight reduction of as little as 10% within a 2-month period can vastly improve the issue. Mental health interventions like therapy and medication may also be part of a treatment plan. Men, and women too for that matter, need to be sure to give themselves adequate self-care and prioritize their holistic health to be happy, healthy, and sexually dynamic. Make the time for yourself. You deserve it. Well, that's it for today. See you next time.